All right, I've already assessed the patient's vital signs and height and weight, and they're all within normal limits. He is his gait is steady and coordinated. His speech is clear. He's alert and oriented ×4, and he's dressed appropriately for the weather. All right, I've also already done the Snellen eye chart, and his vision was 20/30. So what he sees at 20 feet, a person with normal vision would see at 30 feet, and that means that cranial nerve 2 is intact. All right. Hey, my name is Taylor. I'll be your student nurse today. Could you please verify your name and date of birth?
Will Stone, 1985.
All right, thank you. Today we're just going to be doing a complete head and toe assessment, and it should take a little less than 30 minutes.
Okay.
All right, so I'm just going to provide you privacy and wash my hands. So what I'm going to do first is look at your skin. So I see it's even and consistent with genetic background. It's warm and dry. Check your skin turgor. All right, there's no tinting. So they're hydrated, their skin is elastic, and I'm going to also do your capillary refill. All right, it was within less than 2 seconds, which is within normal limits. All right, so that's going to be it for the skin, and so now I'm going to look at your head. So your eyes, nose, and ears are symmetrical. I'm just going to palpate. Any pain or tenderness?
No.
No lumps, masses, or tenderness? All right, so there's no lumps or masses or tenderness, and no lessons. So what I'm going to do now is just feel around. All right. So now what we're going to do is move on to do your. You're just going to do your glands. So here's the pre-auricle, the post-auricle, the occipital, the submandibular, and also the posterior cervical, the superficial cervical, the deep cervical chain, and the that's it. Okay, so now what I'm going to do is go for your sinuses. So make sure there's any pain or pressure in your frontal. Okay, and what about your maxillary?
No.
All right, good. Okay, now I'm going to examine your eyes. So the eyebrows are symmetrical, the eyelashes are evenly distributed. I'm just going to pull your eyes down. The conjunctiva is clear, the conjunctiva is pink and moist, the sclera is white. Now I'm going to get the inner light. All right, if you'll just look straight ahead for me. Okay, the light is reflected bilaterally of both pupils. All right, so now what I'm going to do is look through my ophthalmoscope at both eyes. The red reflex is present, the optic disc is a creamy yellow-orange, and the optic vessels are paired, and arteries and veins have passed through all 4 quadrants. And I would do that in both eyes. All right. Now what I'm going to do is look at inspect your ears, and your tragus. Is there any pain or tenderness?
No.
What about your pinna?
No.
Okay, is there any pain or tenderness in your lobes?
No.
All right, there's no pain or tenderness noted in the ears. Now what I'm going to do is look in them with my otoscope. All right, the tympanic membrane is intact. It's a clear, translucent, pearly gray. The manubrium, umbo, and the short process of the malleus is present, and there's no discharge. And also, the cone of light in the right ear is 5 o'clock, and then I would do this in the left ear. It would be 7 o'clock. All right, put this away. Okay, now what we're going to do is the Weber test. So you can just say, tell me if you hear it in both ears, and just tell me now when you don't hear it anymore.
I hear both ears, and I can't hear it.
Okay. All right. Now I'm going to do the Renee test, and then I'm just going to put it behind your ear and put it on the phone, and then tell me when you don't hear it, just say now, and then in front of your ear and say now.
Okay. Now. Now.
All right. So the air conduction was twice as long as the bone conduction, and in the top of the head, the bone conduction was symmetrical in both ears. All right. So what I'm going to do now is do your cranial nerves. So if you'll just close your eyes for me, and I'm just going to fluid one nostril. Tell me what you smell.
Alcohol.
All right, and the other nostril.
Alcohol.
Okay. All right. And now what we're going to do is the diagnostic positions test. So for that one, his cranial nerve 1 is intact. All right. So if you'll just follow my pen. Okay. Cranial nerves 3, 4, and 6 are intact. All right. So now what I'm going to do is, if you'll just close your eyes for me and tell me where you feel it on your face.
Chin. I mean cheek. Cheek. Chin. Forehead.
All right. Okay. So his cranial nerve 5 intact, or actually I'm going to do another test also. If you'll just close your eyes and stick out your tongue. All right. Tell me what you say.
Sugar.
All right. Cranial nerves 5 and 7 are intact, and if you can move your jaw up and down. All right, side to side. Okay, if you'll just smile for me, frown, and puff your cheeks out. Okay, and blow air out. Okay. So also cranial nerves 5 and 7 are intact. So what we're going to do now is I'm going to do the Weber test, or the whisper test. So if you'll just close this ear, your left ear, and tell me what you hear.
ABC.
All right, close your other ear.
1, 2, 3.
Okay. So cranial nerve 8 is intact. All right. Now what we're gonna do is, if you'll just open your mouth, say ah.
Off.
Okay. And say light type dynamite.
Light type dynamite.
Okay. And also, will you after you do that, just say, so cranial nerve, and I've done the taste test also, so cranial nerves 9, 10, and 12 are intact. Now I'm going to test your cranial nerve 11, so if you'll just shrug your shoulders up for me. All right, and turn your head to the left and to the right. Okay, the shoulder shrug test is passed, so cranial nerve 11 is intact. All right, so now what we're going to do is I'm going to look at your nose. Or sorry, I was using my mic. Okay, the nasal mucosa is pink and moist, and the turbinates are present. The nasal septum is not deviated, and everything is good. So, all right, now what I'm going to do is look in your mouth. So, if you'll just say off for me.
Off.
Okay, the uvula roads with the soft and hard palates. The soft and hard palates are pink and moist. The tongue's pink and moist. The buccal mucosa is pink and moist. The tonsils are present and they're at a 2+. All right, if you lift your tongue up. The stents and Wharton's duct are present. The cranial nerve is intact. Okay. All right. And that'll be it for that. Okay. Now what we're gonna do is I'm gonna inspect your neck. So the trachea is midline. If you'll just turn your head to the right, swallow, and to the left, swallow. Okay, the thyroid was not palpable, thyroid gland. Okay, so now what we're gonna do is I'm just gonna palpate your carotid artery, doing one at a time. Okay, the other one. All right, they were equal bilaterally, and they were 2+. So now I'm going to auscultate with the bill. Are there no bruise present? Alright, now what I'm going to do is feel for your, or actually I'm going to do your heart and chest. So what I need you to do for me first is just turn to the side over here. Okay, feel this, breathe in. Okay, there's symmetrical rise within breathing. Now what I'm going to do is just say 99 for me each time I move my hand.
99, 99, 99, 99, 99.
Alright, the vibrations were symmetrical, felt symmetrically. Alright, now I'm going to percuss. Okay, there's normal resonance heard. Now I'm going to auscultate my diaphragm. Alright, let's take a deep breath. Okay. Alright, there's no adventitious sounds heard with the lung sounds. Alright, you can turn around for me. And now I'm going to use the bell. I'm going to use the bell. Okay, I'm going to listen for the aortic valve, and that is in the second right intercostal space. All right, and the pulmonic valve in the second left intercostal space, and the tricuspid valve in the fifth or the lower left sternoborder, and then the mitral valve in the left fifth intercostal space, midclavicular line. Okay? Alright, there was no bruise present. So now what I'm going to do is feel for your pulses. So I already did your carotid, so now I'm going to do your brachial. Alright, they're 2 plus, felt equally symmetrical bilaterally. Alright, the radial pulse is 2 plus is symmetrical bilaterally. Now I'm going to do your dorsalis pedis, and there's 2 plus felt bilaterally, and your posterior tibial is 2 plus felt bilaterally. Alright, symmetrical bilaterally. Alright, now what we're going to do is, if you'll just lean back for me and pull your shirt up. Okay, the contour is flat, the umbilicus is midline and inverted. There's normal diamond-shaped hair pattern. So what I'm going to do now is percuss, or actually I'm going to auscultate for any vowel sounds with my diaphragm. Okay, there were no vowel sounds present, 5 to 30 a minute, or 5 minutes. And now I'm going to auscultate for with the bell for the pulses, the aortic pulse, the iliac pulse, renal pulse, and the femoral pulse. And I would do both sides. And they are 2 plus felt bilaterally. And there were no bruise present. Sorry. Now what I'm going to do is do a light palpation. Just tell me if you feel any pain or tenderness.
No.
Alright, and now I'm going to do a deep palpation. Alright, feel any pain or tenderness?
No.
Alright, now I'm going to percuss. Okay, there was normal tympany heard over the intestines and the dullness over the spleen and the liver. Alright, so if you'll just take a deep breath for me. Okay, the spleen is not palpable. On to the liver, take a deep breath. Okay, the liver is not palpable either. Alright, actually, so that will conclude the abdominal assessment. So now you can sit up. And now I'm going to do the CBT test and the test for tell me if you feel any tenderness over your kidney.
No. No.
Alright. Okay, now that I've done that, I will do your the range of motion. So what I'm going to do first is I'm going to do your elbows. So if you'll just go up and down for me. Alright, there's full range of motion with no crepitus. Do your left one. Okay, there's no crepitus and full range of motion. Alright, now for your elbows, or for your wrist, if you'll just do like this, and do down flexion, and you did extension first, and then do your lateral deviation from side to side. Okay, there's no crepitus, and full range of motion, and if you'll also do supination and pronation. Okay? Alright, and we would do the same thing for the other side as well. So, now what I'm going to do is, I'm going to do your knees and range of motion. So if you'll just do it, go up, down. Alright, there's no crepitus. Same. Alright, and there's full range of motion in both knees, and there's no crepitus noted. Alright, now I'm going to do your ankles. If you'll just lift your feet up and down, and side to side. Inversion, eversion. Alright, there's no crepitus and full range of motion, and if you'll do the same thing. Okay, alright, there's no crepitus noted. Alright, now what I'm going to do is hold your arm, and if you'll just pull against my resistance. Okay, and now pull it up. Alright, now push against my resistance. Okay, the strength is a 5 with full resistance. I'll do that in both arms. Alright, now for your legs, if you'll just push up against resistance. Alright, and pull against resistance. Alright, there's test strength of 5 and it's full resistance as well. So I would do that in both legs. Now what I'm going to do is assess your reflexes. If you'll just hold your arm up. Alright, there was reflex present 2+. Alright, I'll just hold your elbow. Okay, and the reflex is present at 2+, and I would do that in both arms. Now what I'm going to do is, I will do your knees, so if you'll just straighten your legs out. Okay, 2+, the reflex is present, and I'll do it on the back of your ankle. Okay, and it was 2+, and I'll do that on both legs. So those reflexes are, deep tendon reflexes are present. Alright, now what I'm going to get you to do is, if you'll hold your hand out and touch your finger to your thumb and do all 4 fingers, and then back. And you would do that faster and faster. Okay, his coordination test, he's good. He has normal coordination. Alright, that's good. Now what we're going to do is if you'll just close your eyes for me and open your hand and tell me what you feel.
Nickel.
Okay, thank you. And now what you'll do is hold your hand open and keep your eyes closed, and I'm going to draw a number in your hand and tell me what you feel.
Number 8.
Okay, and that was Gravisthesia, and the first one was stereognosis, and he was he passed both of those. So now what I'm going to do is, if you'll just stand up for me. All right, and now if you'll just put your here first, I'll do the Romberg test. So it'll be if you'll just stand there with your eyes closed. Alright, there's no swaying, and we do that for 20 seconds, and he is good. So if now you can just put your heels in front of each other, and if you'll just walk heel to toe like this. Okay, and back. Alright, you walk in a straight line and with good balance. So let me look over my notes really quick and see if I missed anything, and you can just take a seat for me. Okay, the one lymph node that I missed was the tonsillar, and that is right here. Okay, one other thing, let me look over real quick. Okay, another thing we have to do. Alright, I have two things. So, the first one will be if you'll stand up for me. Okay. So now if you'll just bend over for me and touch the floor. And up. And lean back. And side to side. And if you'll just rotate. Okay, there was no crevice noted in full range of motion in his spine. Alright, if you'll take a seat for me. Okay, so let me do the tip. If you'll just look straight ahead. Okay. Alright, and now if you'll just if you'll just stare behind me, and now stare at the object in front. Okay. His pupils are equal, round, reactive to light, and accommodate. So that's going to conclude our test. So thank you very much.